It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So folks, we're in for a lesson today. You remember when I tell you when I do these shows, I learn so much. What do you know about podiatric surgery? I don't know that much about it. I know what a podiatrist is, but podiatric surgery, once again, the Lehigh Valley Physician Group just keeps on raising the bar. Today, we have Brittany Portonova on the show, and she's going to talk about podiatric surgery and about podiatry. Well, Brittany, thanks for coming on the show.
Thank you.
You're native here, right?
I am.
From good old Freeland, huh?
Good old Freeland, Pennsylvania. I was born and raised here. Went to Hazleton Area High School.
Yeah. What year did you graduate?
2005.
Yeah. I graduated 2000, I think it was. 5 years.
Yeah, I think I remember seeing you.
You remember seeing me in the halls, right? Yeah. So you went to Hazleton High School, all right? So now I always ask, my guests, especially doctors, well, what happened that you decided to, go into medicine and then go into podiatry?
Well, it started off in high school with my biology courses. I really fell in love with science and knew that that's the track I wanted to take for college. And once I was in college, I just really got exposure to medicine and knew that that's something that I wanted to be a part of. Podiatry itself probably came from the fact that I visited podiatrists frequently when I was younger.
Why?
Well, I was part of the cross-country team in track and field in high school. I was an avid dancer, so needless to say, my feet were not in the best of shape all the time. So I was very familiar with the profession from an early age.
So you decided in high school to go into podiatry?
Yeah, high school, more so college maybe was the time.
What did you major in college?
Biology.
Biology. All right, so you decided to go into podiatry, then where did you go?
So once I graduated from King's College, I went down to Philadelphia.
King's College?
King's College,
I
yes.
knew I'd liked you as soon as I saw it. King's, that's where I graduated.
Oh, okay, great.
I think I graduated in 2002. I don't know what's
Okay, I was 2008, so.
Did you see me in the halls?
I did.
Okay. So you went to what school after you graduated from King's?
I went to Temple University School of Podiatric Medicine in Philadelphia.
Okay. And there, you graduated?
Yep, that's 4 years. Once I graduated from there, I went on for my surgical training, and I finished that at Hahnemann University Hospital, which again is in Center City, Philadelphia.
How exciting was that for you?
It was really exciting. It was a very grueling program. It was a very long 3 years, but I got a lot of diverse exposure and really enjoyed my time there.
It's a great hospital.
It is, yeah. Level 1 trauma center, so they're very busy.
What are some of the things you remember the most when you were there training at the hospital?
I think it's just my initial first hands-on exposure to everything. When you're in school and you're learning about it, it's one thing, but when you're actually doing the surgery and you're actually treating patients, it really sticks with you. It was just really great transition from school to residency.
Now, what was did you do surgeries yourself, or were you accompanying with somebody?
We're always accompanied with an attending, but as residents we are participating and performing the surgeries. Okay.
Now, I'm going to ask you about, podiatric surgery and podiatrists and what people think of podiatrists, but when you were in Hahnemann, okay, what was probably one of the most severe cases, if you can remember, that you had to work with?
For me, it was a younger gentleman that was in a car accident. He had fractured the calcaneus, which is the heel bone of his foot, as well as his ankle. So that was quite an extensive break and injury that he had and required a lot of reconstructive surgery. So I think that case is one that sticks with me the most.
Okay. What did you learn most from Hahnemann?
I think just to get to know the patient.
Yeah.
I really met a lot of great people in Philadelphia, and Hahnemann, being right in Center City, you meet a lot of different people, and that was great. Okay,
now when people think of podiatrist, okay, I'm thinking of, well, you're cutting my toes, you're checking my corns, maybe you have some calluses, on my foot or whatever, what's the whole scope of podiatric surgery?
Well, the scope that you're thinking about is what originally podiatrists, it's all that they did.
Yeah.
Podiatrists were just your basic nails, calluses, skin conditions, and things of that nature. But our field wanted to become the leaders in expertise of foot and ankle. So they really, over the last 25 years, developed more strict surgical programs, added to the length of the surgical program, and also honed in on reconstructive surgery of the rear foot. So now our scope really encompasses anything the conservative treatment the podiatrists used to offer, as you had mentioned, but also bunion, hammer toe surgery, spur removal, fixing of forefoot and ankle fractures, reconstruction of the rear foot, a little bit of everything, really.
So what about people who get fungus on their toenails and stuff like that? You treat those as well?
Absolutely, yes. No problem is too small or too large. We treat everything.
Yeah. Okay, so now why, you know, everything's okay, but it's like you should go to a doctor at least once a year to get a physical. You know, blood work or whatever, prostate examinations, you know, mammograms, etc. So why should I go to a podiatrist? I think my feet are okay or whatever. Why should I come to a podiatrist?
Well, I think the biggest complaint that I'll hear from my patients is that they waited too long and that they took their feet for granted. You kind of forget that they're there and getting you through every single day until they really start causing you a problem. But making sure that you're taking care of your feet is extremely important. And that really starts with the shoes that you're putting on your feet. And I think that's something that a podiatrist can offer a lot of insight to, so that you're just maintaining and keeping your feet healthy.
Okay, now, wow, taking care of your feet. I mean, I wash my feet every day, you know, make sure I get the proper, you know, shoes. So talk about proper shoes. I mean, are there people out there that do not have the proper shoes?
Absolutely, and a lot of that actually starts with the size of the shoe. So a lot of us...
Well, wouldn't they know if the size is tight or big or whatever, or small?
You would think, but it depends on what time of the day that you go to buy your shoes. So if you were to go in the morning, per se...
Women, listen.
Your feet are going to be naturally a little bit smaller. As the day
goes...
goes...
in the afternoon?
In the morning, your feet will be smaller. You'd prefer to buy your shoes in the afternoon or evening after your feet have naturally had a chance to swell, which is completely natural, but it will adjust the size of your shoe. And you should always be measured. The size shoe that you were measured for when you were a teenager or in your 20s could be different now. Your feet change shape, they may become wider, they may even become longer.
Okay, tell me about foot care. Okay, so if, you know, really people would say, well, I really have no reason to go to a podiatrist, you know, unless you have an ingrown toenail or, you know, someone would cut my nails. I guess there's proper ways of cutting your toenails, correct?
Sure, absolutely. A lot of people like to
You do that as a podiatrist?
Yes, always. We trim nails, we take care of ingrown nails, any sort of nail deformity or anything that causes pain with the nail bed. We will treat all of that. A lot of people like to perform what we call bathroom surgery. So that's when they're having trouble with their nail, pain, they like to dig at it themselves. And really all that ends up is an infection and a worse problem than what the patient actually started with. So it's better to just come in and be seen. And even if you think it's something silly, it's better to have it checked out.
Okay, so cleansing your feet is important, right? Okay.
And more importantly, even drying your feet very well after you cleanse them. If you leave your toes too moist, you can develop a fungus. So making sure to dry your feet really well after showering, wearing all cotton socks, and also don't hang on to that pair of shoes that you've been loving for years. Chances are they're harboring fungus.
Well, yeah, I just hit a sore subject. Seriously?
Yeah, it's easy for people to hang on to a comfortable pair of shoes that they've fallen in love with over the years, but fungus is a natural occurrence.
Were you talking to my wife?
Maybe.
That's amazing. So, well, how long should you keep your shoes?
Typically, it depends on how well you're taking care of them. You can spray them out with an antifungal spray, but also the wear of the sole. You want to keep a good shoe that's going to be supportive, and if you're an active person and walking a lot, sometimes it can be as simple as 6 months, and you really need to get a new sneaker.
You definitely were talking to my wife. She's an RN, and she tells me everything what you're just saying. She just tells me the same thing. So, I mean, proper shoes, make sure the soles are there, okay? Make sure you get them, make sure your feet are dry, okay? All right, so assuming we do all that stuff, what are the most common things that will happen? Now, as you get older, does it increase older, or is it young people? Or, well, of course, it happens to young people if you're an athletic person, right? What was some, if you don't mind, what were some things that were wrong with your feet, or not wrong, but why did you have to go to a podiatrist?
Well, I had flat feet, so
do I.
That's when my arches have fallen, and that leads to a lot of different problems. Your tendons can become inflamed and even tear. You can get problems or pain within your joints, so something that podiatrists offer is an orthotic. It's a custom-made insert that goes into your shoes that actually helps to align your foot a little better. And I relied on that heavily when I was involved in sports when I was younger, and even now. Were
you getting pain, Brittany?
I was, yes. And my orthotics really helped a lot with that.
So why didn't you go to a foot surgeon or to, other than going to a podiatrist?
Well, podiatrists in this area I just knew to be the experts on the foot at the time.
So what is the difference between, you know, podiatry service, podiatric service versus foot surgery, okay, a foot and doctor, which you got at Lehigh Valley as well?
I think it's all encompassing. The orthopedic department, they treat head to toe, and they still do foot and ankle as well. So there is an overlap with podiatry versus orthopedic surgery, but a podiatric surgeon does both. We treat the basic conditions of the foot, as you mentioned, that podiatrists do, but we also cover the surgery aspect of everything as well.
So there's general care of the feet. If you don't take care of your feet, okay, what can happen?
Well, the most common conditions we see are typically deformities that actually have been there for a while but don't start causing pain until you're older. So bunions, hammer toes, flat feet can cause pain at any time, but often will become worse as you're older in age. Obviously, sports-related injuries, fractures, sprains, strains, tendon tears, things like that. Those are all things that we treat. Also, another side of what we do is diabetic wound care. A lot of diabetics can't really feel well in their feet, so they develop wounds and ulcers, and I also do a lot of wound care for them as well.
That's an interesting point, diabetics, because sometimes they can't feel their feet, right? Yes. And they don't know what's happening, okay? So if you're a diabetic, it would be wise to maybe just come and get checked out?
Absolutely.
What do you do, like, if you're a diabetic? Is there a certain test that you do on the feet, or could you see it through your eyes and know what's going on?
When a diabetic comes in, we'll perform what's called a diabetic foot risk assessment. So we look at a couple different areas. Mainly we look at circulation, wanting to make sure there's enough blood flow going to the foot to keep it healthy.
Is there a test for that?
It's just really feeling the pulses. If you can't feel the pulses, we can use a special device to actually listen a little closer. If there's a question of vascularity, then we can send them for other special tests at the hospital or refer them to a vascular surgeon. Okay. But it's a basic screening to make sure that they're getting adequate blood flow. Other than that, you're also looking at the sensation. As you mentioned, they can't really feel that well, so there are certain devices we can use to assess how good the sensation is on the bottom of the foot. And then we're also going to be looking at deformities that that patient might have that can lead to pressure sores or places where ulcers can develop. And then we also want to assess skin integrity, make sure there's no skin breakdown or signs of calluses that have been forming that can also lead to ulcers or more serious infection.
So it would be a good thing to do if you're a diabetic, just to maybe give you a call and say, just come in for a general checkup, even though you may not have any things, any pains or whatever, but just a general checkup.
Absolutely.
What about socks? What kind of, sometimes people are wearing socks, but sometimes they could be too tight around the ankle, or during the day as a person's, as you say, you're swelling up, okay, and sometimes there's wrinkles around the ankles, or, from the socks.
Sure.
Women are wearing, these stretch, or what do you call them, the socks?
Pantyhose or stockings.
Stockings that are, just tight. What about that?
Well, it is a common problem. A lot of people do develop swelling in the legs, and if you don't have a sock that is all cotton or has a nice band at the top, it could cut into the skin and even cause an abrasion or an irritation of the skin. So diabetics will actually have something called a diabetic sock. It has a nice loose elastic band at the top, or actually lack of elastic, so that it won't cut into the leg. And then also something that can be worn to help combat that is an actual compression stocking, something that's made to be worn to the level of the knee to be able to eliminate or prevent swelling from building up as the day goes on, and that will prevent those lines that you're speaking of. Yeah.
So you check for that. You check for that as well. So cutting your toenails, okay? I use a hedge cutter, No, I'm only kidding. What proper way do you cut your toenails? Is there a special, cutter for them, or for your toenails?
Well, some nails are very difficult to cut, whether it be from a fungal infection or just chronic wear and tear on your feet. Your nails can just become thicker over time. So oftentimes we have the special heavy-duty tools in our office because we won't necessarily trust everyone to use those on their own. But for the average person to just cut their nails at home, it's best to just cut straight across. Don't be digging in any corners because, again, you can cause infection or irritate the skin.
Not like your fingernails?
Correct.
Okay. So they should be cut straight across?
Yes.
And there's certain cutters for that, right?
There are various ones in the pharmacies or different drugstores that you can find, but whatever you're most comfortable with.
You should get a good one, though. Yes. But it should be a toe cutter, not a fingernail cutter, right?
They're kind of one and the same, but ones for the feet will be a little larger.
Yeah, a little larger. The most common problem that you the podiatrists see, what is the most common problem?
I would say bunions and hammer toes are probably the most common across the board.
Can bunions be prevented?
Yes and no. Bunions.
Give me the yes part.
So, I think you can prevent them from becoming worse. It's a congenital thing, so it's within your genes. It's your foot type.
What is a bunion?
It's actually caused by muscle imbalance. So your muscles are pulling on bone in a way that they're not supposed to be pulling. So it causes the bones to be positioned out of their normal alignment. Hence, you get this large bump on the inside of your foot that could become irritated.
Now you say that's hereditary?
It is hereditary. A lot, if you notice, someone may have a bunion. If you look to your parents, they might have had a similar foot type. But if you're prone to getting a bunion and then you wear narrow shoes or certain types of shoes that can actually promote a bunion, you can make it worse in a shorter amount of time.
Okay, just to get back to the shoes a minute. Sometimes, I know, I buy a good pair of shoes, okay, because, I want to make sure it's a good pair and it'll last me a long time.
Yeah.
Now you're saying that's not a good thing?
Well,
Please don't say that.
Buying a good shoe is definitely a good thing.
Yeah.
I mean, shoes can be very expensive when it
Yes.
comes to sneakers, but investing in a good shoe is going to keep your feet healthier longer. You just have to keep an eye on your shoes. If you're very active and you're doing a lot of walking, they just need to be
But
replaced.
the soles have to be replaced sometimes,
Yes.
even though they're good ones. All right, so socks and shoes, what I'm trying to think, I'm trying to give the viewers an opportunity as to, how do you, foot care. Okay,
Sure.
good foot care. Okay, so cleaning the feet, making sure they're dry. What about powders or anything?
Powders are great. Antifungal powders or just powders to keep your
You
feet
do the
dry
whole foot
during
or
the
just
day.
the toes? Or?
You can do just the toe area. It's all dependent on where you feel the moisture. You can also just put it in your shoe or spray out your shoes as well. So any of that is beneficial.
So you, as a patient who went to a podiatrist, okay, so are you still going to podiatrists to take care of your feet, or are they pretty good now?
They're pretty good now.
Are they? Yeah.
But I guess going to podiatry school helped a lot because I learned a lot of good things about my feet.
What'd you learn about good things about your feet? What'd you learn?
Well, I learned about my foot type and why I was having the problems I did when I was younger. I was an avid runner, so I understood better why my feet were hurting me while I was running.
Okay, which reminds me, there are people who like to jog.
Yeah.
People like to walk a lot. Okay,
Yes.
and my wife walks a lot. How do you take care of your feet? What you be doing? Because I think joggers are pounding their feet and their knees, etc. 9 times out of 10, as they get older, they're either replacing their knees or whatever. I mean, that's fact. So what would you do? What do you recommend a person who is, first of all, they should have a good sneaker, right?
Yes, and
Okay.
the running shoe industry has really taken off. There are so many different types of running shoes now, and they're all geared towards different types of feet. So someone with a high arch would need a different shoe as someone with a low arch. And really the best way to be evaluated with that would be come in, let me see how you walk. I can get an idea of what type of foot you have, and then I can actually recommend what type of running shoe or walking shoe would be best geared for the patient.
I think that's critical because some people young, they'll look for the best bargains, which is
Yeah.
okay. They look for the best bargain. Really, they're doing damage to their feet. They can't tell it now, but later on, they'll be able to tell that. Correct?
Yeah, the earlier on that you get a good shoe, especially for running or when you're going to be active in sports, the much better you are at preventing injury and problems down the road.
Women buying shoes. Okay, what's your suggestion to them? Because women like to buy
It's very
shoes.
difficult. It's hard to find a good shoe for females because a lot of females focus on fashion and not always the comfort. But if you're looking for fashion but also want to have a comfortable shoe, females should really tend to go for a smaller heel, something around 1 to 2 inches, and actually look for a wedge or something with a very thick heel that helps to distribute the weight really evenly over the foot so that if you have the shoes on for a long period of time during the day, you're not going to get extremely uncomfortable from them.
So, I see some women who are beautiful women, dressed very nicely. I mean, they're beautiful shoes, but they're like this big. The heels are this big. Okay, I don't. First of all, I can never. Well, of course, I'm a woman, but how you walk on those things? Do you have heels that big?
I'm pretty tall, so I
Yeah, I know
don't
that.
own a
I
lot
saw
of
that.
heels.
Lisa
that-
better stop bringing tall people to me. So you're saying the tall heels, maybe if they're just going out for a shorter period of time, for fashion design, etc. Because some of them are really beautiful shoes.
Yes.
But basically, you shouldn't be on those shoes a lot.
A really high heel is going to increase the pressure on the forefoot or ball of the foot immensely. So it can really lead to a lot of pain and problems within the forefoot. So I don't recommend anyone throw out their heels. They're obviously really nice, but I think what's great is that if you're going to an event, bring another pair of shoes with you that you can change out of to be more comfortable.
Folks, I tell you, I learned a lot today. I'm learning a lot. We're talking to Dr. Brittany Portonova, who is a podiatric surgeon. Now, remember, 501-570-4LVH is the phone number to call. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. We have an interesting show for you today. Podiatric surgery. We have Dr. Brittany Portonova, who is a podiatric surgeon, and she's with the Lehigh Valley Physician Group Podiatry. Now, you're with Lehigh Valley, great, one of the best organizations, you know, as far as healthcare is concerned across the board. Tell me about your team.
I'm in the orthopedic department, so we have Dr. Horton and Dr. Kazicki. We also have Dr. Abbasi, who's a physiatrist.
You're not working with Dr. Abbasi, are you?
Yes.
Oh, man, I'll tell you. He's a tough guy. I'm only kidding. He's a good friend of mine.
But it's really a great team. They've already been offering such comprehensive services before I even come aboard. But
so how do you work with them? Orthopedic. Where's the crossover? I mean, like, when do you take over and when do they take over? Like, see, I see like a little conflict maybe, or maybe
there
not.
is some crossover with what we perform, but it really comes down to the patient. If I have a patient that comes in and I'm comfortable diagnosing and taking that patient to the operating room, then that's something that I'll handle. But there are cases that we may refer back to one another to get professional opinions upon. It really comes down to just treating the patient and making sure they get the best care.
And that's the thing that I think is really important, that, you know, that you're able to, you know, confer and, you know, etc. So I could see you going into Abbasi's office and saying, listen, this is my patient, I'm taking care of this patient, I don't want to hear anything at it. You should do that once in a while. Just say, Sam Lesante told me to say this.
Okay.
You know? No, I think the team effort that you have there is very important, because you can, you know, you have other eyes looking at what would be, other than diabetes. I mean, if you're diabetic, I definitely think you should come in and get your feet at least checked, okay, like you get your, you know, your physical. So the most common problems are, what'd you say?
Bunions, hammer toes, but we also see a lot of heel pain, fractures, spurs, arthritis, wounds, ulcers, things like that.
So, excuse me, if someone's having soreness of the feet, or, you know, when they put their shoes or take their shoes off, or their feet are killing them, as they say, there could be some problems with the shoes, and like you said, that's one of the most common. And what happens? They come in, they're not getting the proper shoes?
Yeah, sometimes it can be just due to the shoe. Something simple as too tight of a shoe, or the style of the shoe, or the way that the upper or leather of the shoe hugs the foot could be causing the pain. Pain should never you never want to have pain that's going to cause you to limp or alter the way that you're walking, because that's just going to cause a whole slew of problems from your knees, hips, back, and up. So anytime you're having pain, just come in and be seen. We perform a comprehensive exam, really take a good history to find out, is the pain coming from the shoe, or is this coming from a problem in your foot instead? And then we would take an x-ray, or sometimes further studies if certain structures need to be looked at or evaluated better.
I think that's excellent advice. Folks, I'm talking to Dr. Brittany Portonova. And remember, folks, ssptv.com, you're going to watch all of our health shows, or every one of them are there. And also, my email is sam@ssptv.com. Now, the phone number to get in touch with Dr. Portonova, Brittany Portonova, is 570-501-4LVH, okay? So comprehensive orthopedic service you have available at Lehigh Valley Valley Physicians Group, okay? Now, you're located at the Health and Wellness Center.
Yes, I am.
Okay. Finally, we got about 2 minutes left before my son starts yelling at me again. What is the proper foot care? You know, what do you advise our viewers to do, you know, besides soak their feet? That's another thing. Some people say soak your feet in Epsom salt. What is that? What does that do?
Yeah, that's great. It helps to relieve muscle tension, the warmth of the water, and Epsom salt.
Is it a special sauce, right? Salt.
Epsom salt.
Yeah.
Yeah, you can put Epsom salt in warm water. Soaking your feet will help to relieve tension. Also will help with inflammation that you're having. So
not too hot with the water.
Not too hot, lukewarm. And if you're a diabetic, you should always have someone else check the temperature of the water for you.
You can't tell.
Yes.
That's it. And so that like sort of relieves it.
Absolutely, it'll help with pain and get you a little more comfortable.
Should you do that once a week, once every day, or what do you think?
Just as you need for pain and discomfort. You know, if we evaluate you and we see maybe there'd be something better that might help better than a foot soak, then obviously less frequently. But there are a lot of people who do foot soaks and get good relief from them.
Do you recommend that sometimes?
Yeah, absolutely.
Yeah. So general foot care, I'm telling you, I'm learning a lot here today. You know, you just think, you know, cutting the nails, you know, bunions or corns or whatever. How do corns happen? What happens?
It's actually from pressure or irritation from your shoe. So when you have repetitive friction from your sneaker or on the bottom of your foot from the pressure of your actual body weight, it's your body's natural defense mechanism. So it actually builds up thick, dead skin. But your own defense mechanism causes you pain. So that's when you can come in and we can actually shave down and remove the callus to eliminate the discomfort.
Well, that's quite interesting. Brittany, you're really a smart girl, I tell you. That's, I didn't expect anything less, believe me. But there's a lot that you learn. Sometimes, you know, when you're learning today to become a physician, there's so many new things that are available that were not available, you know, 5-10 years ago. And you're able to bring this new technology, you know, to Lehigh Valley Health Network, and I think you do very well.
Thank you.
I wish you the best, and thanks for coming on the show.
Thank you so much.
Tell Omar Abbasi I said hi. Okay?
I will.
He's a nice person. Folks, Dr. Brittany Portonova, who is podiatric surgeon, podiatrist. I highly recommend that you give her a call, get your feet checked, particularly if you're diabetic. Are you wearing the proper shoes, socks, etc.? All this stuff that you can eliminate, hopefully, like that, right, Brittany? Her number, 570-501-4LVH. We'll see you next time.